Hello, my name is Rod Raabe. I'm an interventional radiologist from Spokane, Washington. It's a small country town in the northwest of the United States, and I've been here for 28 years. A lot of people ask me how varicose veins have been treated in the past, and for years the gold standard was surgical stripping. Surgical stripping is a very invasive technique that requires the patient to be under general anesthesia because it's very painful. You make large incisions and actually you put a hook into the vein and you rip it out inside out. It worked and it was effective, but a lot of patients would rather put up with a varicose vein than to have the surgical stripping where they're ripping out the vein and having to recover from it. About 10 to 12 years ago, a new innovation or a new idea came up where you could actually put a little tube into the varicose vein that causes most of the trouble and put numbing medicine all around that vein using needles under ultrasound guidance. It was the development of ultrasound that really allowed us to be able to place these little tubes and to place the numbing medicine. Well, we still have to, with these therapies, which are called radiofrequency ablation, or something that we've all heard of, laser, it still requires an intense heat. In fact, the laser probe will heat up to over 700 degrees. So without that numbing medicine around the vein, you would feel that. And even with that, we have to be very careful that we do not burn any parts of the surrounding tissues around the vein to prevent any side effects. What is Veselības and how does it work and how is it different from the current thermal ablation technologies? Well, Veselības is a medical adhesive where the basic ingredient is cyanoacrylate, which has been used in the body for 40 to 50 years and has been shown to be very safe and effective. The procedure is done using a small little tube which is placed into the vein. It requires just a single little needle puncture with lidocaine or just a little bit of numbing medicine. The catheter goes into the vein. You do not feel the catheter in the vein. We put a very safe medical glue that closes the vein. You do not feel the closure of the vein. You do not even feel the mechanism of the vein shutting as we apply the very, very small amount of safe medical glue. The catheter is pulled back, injects the glue. You put a single Band-Aid on. You require no extra numbing medicine beyond that. You require no sedation or more anesthesia. You do not require compression stockings, which is often difficult and hard to wear. You place a Band-Aid and virtually immediately you go back to your normal activity.